what advice do you give for someone who has, maybe they've had chronic pain, they've gone through, or they're in that, I guess the best way to put it, I guess the traditional methods?
Yeah.
Is that what we say?
Yeah, very biomedical approach is what they find, and what most people find.
All right, so that's a big word. So tell me what that means.
So biomedical means, it's the viewpoint of healthcare that says something's wrong with you, you have pain. The reason you have pain is because there's something biologically wrong with you. Maybe it's a muscle imbalance, or maybe it's physiological, maybe you've got some endocrine problems, or like hormones shooting, or neuromuscular, or whatever it is. But the biomedical approach says, okay, if we fix this physical problem with you, you will have no pain, right?
Okay.
And what we know from the science and from the literature is that that's not necessarily always the truth, right? So we take it's called a biopsychosocial approach here at the clinic, which means that we don't just look at the physical, at the tissues, the muscles, the joints. We look at you as a whole person. So really what that means is your context. So what we know from the literature, and especially from areas like working with veterans with PTSD, is that two patients might have the exact same diagnosis, maybe the exact same etiology, or the reason for the diagnosis. Maybe they both fell and injured their shoulder, right? Same type of fall, same shoulder, all things being equal. One patient gets totally better using traditional methods or standard care, right? And the other person doesn't. Well, why is that? It's because outside of what is going on physically, there's a whole other context behind that person. So maybe the person that didn't get better has PTSD, or has some sort of psychosocial stressor that's really affecting their real and lived experience of pain. And that's really what we try to focus on here at Proactive, is not just, let's look at more than just the tissues and the joints, and really look at you as the person, and why might you be experiencing pain, even going above and beyond the normal treatment that you've had over the years, right? Like, what have we missed?